You can blame it on the food that is too high in fat and sugar, or you can blame it on a lack of exercise, or both. But according to the World Health Organization, hundreds of millions of people around the world are gaining weight, and the fatter they get, the greater their risk of diabetes. Obesity and physical inactivity are common conditions associated with type 2 diabetes. The WHO projects that 330 to 360 million people will be diagnosed as diabetics by the year 2030. Doctors have preached diet and exercise to patients for decades. Now, researchers have noticed that high levels of one fat-producing hormone is not such a bad thing after all. Rob Van Dam is with the Harvard School of Public Health.
It's the fat that you have on your body, and we thought it's just sitting there not doing much, but it's secreting all kinds of signaling molecules, among which adiponectin seems to be an important one.
Scientists have known about the fat-producing hormone adiponectin for some time, but Van Dam and his colleagues at Harvard have looked at studies of at least 14,000 patients and confirmed something interesting. They're not sure why, but patients with a lower risk of type 2 diabetes seem to have higher levels of adiponectin.
It actually has beneficial effects on the liver and on muscles, and it increases insulin sensitivity, it seems, and it reduces inflammation.
Van Dam says the link between adiponectin and a lower risk of the disease is consistent, regardless of an individual's body mass index, gender, or race. That, he says, raises hope for screening and further treatment involving adiponectin or in prevention of the disease itself.
It's an interesting finding because we know that certain ethnic groups, certain racial groups seem to be more sensitive to develop type 2 diabetes.
The research appeared recently in the Journal of the American Medical Association. Melinda Smith, VOA News.